Hey everybody, welcome back to my channel. Dr. Hope here. So a few years ago, I had a new patient walk into the office. He was in excruciating pain. He was walking slightly bent forward, limping because he had pain going down the leg. And just the way that he walked into the office or walked into the exam room, I knew right away that he probably had a bulge or a herniated disc. We sometimes refer to that as having a hot disc. While doing the doing a complete history, and I asked him, what happened, what precipitated the pain, and he said that really nothing. He was washing his truck and he sneezed while bending over, and the pain just made his knees buckle and he went to the ground. And while I was doing the examination, I asked him, well, how did you find out about my office? He said about a year and a half ago, our office was giving out free t-shirts, and he happened to be using one of our t-shirts as his rag. Well, MRI actually confirmed my suspicion that he had a herniated disc. So what's the difference between a herniated disc, a bulging disc, and even a desiccated disc? Well, in this video, I'm going to break it down, and I'm also going to answer the question, what happens to your spinal discs when they are injured? And I'm going to explain the difference between disc desiccation, disc bulge, disc herniation, and whether or not your disc can actually slip. Stay tuned. The discs in your spine are cushioned between each of your vertebrae that act as shock absorbers. They're made up of two primary components. You have the softer, jelly-like center, that is called the nucleus pulposus, and then you have the outer layers. They're a tougher, elastic, fibrous tissue or fibrous band called the annular fibers or the annulus fibrosus. Your vertebral discs are full of fluid that keeps them both flexible and sturdy. As you age, your disc begins to slowly dehydrate or lose its fluid. This dehydration is called disc desiccation. Disc desiccation is one of the most common features in the early onset of degenerative disc disease. This is an example of a desiccated disc. You notice in comparison to a normal disc, the disc height is slightly less, and that usually is what happens when a disc begins to dry out. It loses some of its height and it begins, as I mentioned before, it loses its fluid. Over time, as your discs dehydrate or begin to desiccate, it'll cause changes in the outer fibers, and as that outer fibers begin to stiffen and your disc lose height, the disc begins to bulge out, and this is called a disc bulge. A bulging disc is like a flattened jelly donut without the jelly actually leaking out of the donut. With a disc bulge, however, only the tough outer fibers are actually involved. This differs from an herniated disc where the outer fibers actually tear or crack and the softer jelly center begins to leak through. You can actually herniate your disc due to trauma, such as a car accident or a sports injury, or just having a long-term wear and tear that causes degeneration of the disc itself. I'm going to grab my little model here. Hopefully you can see it okay, but a herniated disc, you see the soft jelly center has actually leaked through the outer fibers because there is a tear in the outer fibers. And usually when you have a disc herniation, there's other signs of degeneration, wear and tear to the actual joint itself. And also with a herniation, that can put pressure on the very sensitive nerve root of each of your vertebrae. Herniated discs are often referred to as ruptured disc or slip disc, except the whole disc never actually ruptures and it doesn't slip. The only area that's involved, as mentioned before, is just the area of the torn outer fibers. Now, compared to a bulging disc, a herniated disc generally causes a much greater significant pain, primarily because it bulges or protrudes further out, and it can irritate those sensitive nerve roots, as I mentioned before. Irritation can come from compression of the nerve or actually just, which is more common, inflammation of the nerve root. Disc bulges and herniation can lead to severe pain pretty much anywhere along the spine, although it's most common in the neck and the low back. Some of the symptoms associated with a bulging or herniated disc in the low back includes pain while sitting. Now, sitting exerts a tremendous amount of pressure on the low back, and when you sit down, herniated or bulging disc can become even more pronounced and increase the irritation to your low back. Pain radiating down your leg is also another sign that you may have a bulging or herniated disc. The disc in your low back typically herniate or bulge in the back or to the side region of your vertebra, causing compression or chemical irritation of the nerve root. Usually that leads to burning, numbness, tingling, either in the front, the back of your thigh, leg, or foot. If you have low back pain or sciatic pain that worsens with certain activity, you may have a disc bulge or even a herniation. These activities include bending forward or bending down, lifting a heavy object, pushing or pulling a heavy object, coughing, or even sneezing can increase or worsen pain if you have a bulging disc or herniated disc. Of course, diagnostic imaging such as an MRI is needed to actually diagnose a bulging or herniated disc. So if you suspect that you may have a desiccated disc, herniated disc, or bulging disc, you definitely want to contact your doctor. With a desiccated disc, however, you may experience mild low back pain, some tension, but definitely if that pain increases or you notice some of the symptoms that I mentioned, you probably have a bulging or herniated disc. Call your doctor. I hope you got something out of this video. If you did, go ahead and hit that subscribe button. Like, leave a comment. Let me know, do you think you have a herniated disc or bulging disc? Have you ever experienced one? And please share. Until next time, God bless.